this is Sumant and welcome to the next part of ENT. So today's topic is a very important topic. There is no question paper, there is no central exam which haven't asked this question till now, till today. So this is a very important question. Almost in all the state exams, all the central exams, we could able to see this. So that's what. It's a very important condition. Now the one which I'm going to discuss is airway foreign body. Clear? Right. It's a very repeatedly asked question. Again, I am telling you. So I want everyone to prepare your notes and go thoroughly to this topic. Right? Okay. So now starting with, now can anybody tell me what is the most common foreign body? Right? So what is the most common foreign body? If anybody asks you, right, I already told you this, nothing to scratch your head, my dears. I told you already in pediatrics. What did I teach you in pediatric pulmonology? I taught you about foreign body aspiration, right? The same in ENT point of view I'm going to teach you here. Now quickly tell me, right, what is the most common foreign body in children? Yes? Why am I telling you about children? Because foreign body aspiration is the one which is very common even in if it is whether it is pediatrics or whether it is ENT. I'm not worried about the departments here, but foreign body aspiration is more common in what age group? Right? Yes, you're right, it is children. Okay, right. The most common foreign body is, yes, can anybody tell me? Peanuts. Very important. The peanuts, okay, they keep in mouth and they aspirate, right? So they keep in the nose, right? Some few children and they aspirate it, okay, right. Most common age group. What is the most common age group? Can anybody tell me what is the most common age group? Yes, Sumant sir already told that foreign body aspiration is more common in children. So now you should not give me the adult age, give me the children age. What is that? It is not which age group of children? It is 1 to 4 years of age group. More common is foreign body aspiration. Clear? Right. So now, right. Now, so and so the child had aspirated the foreign body, so and so peanut, and now, so that's why please don't give peanuts or any chota objects to the babies. Okay, they will aspirate it. Okay, they can choke the airway, right? They can enter into the bronchi, right? Many things can happen. So now, be cautious with children always. Be cautious with children always. No sharp objects, okay, and no chota objects also. Chota objects will lead to foreign bodies, right? They aspiration, okay, right. Mainly the peanuts is the most common foreign body that we see in day-to-day life, right? Now, so and so now the peanut entered the respiratory system, right? So, right, the child had aspirated. Now tell me at what level of your airway this peanut will go on stuck, right? Now this peanut, the child aspirated, can go and stuck at 3 different sites. Any one among these, right? It can get stuck at the level of, what is this one? This is your larynx. Very important. It can go stuck at the level of larynx, or it can get stuck within the trachea, right? Anywhere in the trachea, right? Or the foreign body can directly go and enter the bronchi, right? Very important. It can go and directly enter the bronchi, right? So what is this? This is the bronchi. I know it is bronchi, but why I am more worried about whether it is right bronchus or left bronchus? Can anybody tell me whether it is left or right, which is very common? It is the right bronchus which is very common. Why it is more common? I told you, for this you need to go back into the anatomy aspects. I told you in anatomy, right? Right, in anatomy I have beautifully told you that so trachea, it's right yes, I know the trachea will get divided at the level of carina into right and left bronchi, okay, but Remember always, right bronchus is a continuation of the trachea. Okay, so right, it is in the same direction of the right bronchus will be in the same direction of the trachea. Okay, so it is just a continuation of trachea, right? So whatever you aspirate into the trachea, it can directly go sit in right bronchus. But what about left bronchus, Suman sir? See here, my dears, left bronchus will be at an angle, right? So it is not, it will be at an angle so that it can, whatever coming into the trachea, it cannot easily enter into the left bronchi because it is an present at an angle. Okay, so now you will not understand how, however, if I, even if I'm breaking head, you cannot understand. So let me draw the diagram and show you, right? So see here, this is the trachea, right? So this is the trachea. What did I teach you just now? Your right bronchus and left bronchus, right? So right bronchus is the continuation of the trachea. So see here, right bronchus is a continuation of trachea, but left bronchus will be present at an angle. It will be present at an angle. Okay, so like this is the left bronchus. It is present at an angle, so whatever coming, it will not enter the left bronchi, instead it will enter the right bronchi. So this is the right bronchus and this is the left bronchus. So whatever the foreign body which had entered the trachea, now it will directly go to the right bronchus, right? But it cannot go to the left bronchus. Why? Because left bronchus is present at an angle, right? It cannot go into the left bronchi. Can you see it is present at an angle here, right? Okay, understood, right? Should I need to teach it once again? Please go watch my anatomy video. There I have explained this concept beautifully. I have explained you. Go, right. Now, so again I am telling you, the most common foreign body is the peanut. Okay, the most common age group is 1 to 4 years, that is children. Clear? Now, the foreign body, whatever it may be, it can be a peanut, it can be a coin, whatever it may be, it can stuck at 3 different levels in the airways. Number 1, it can stuck in the larynx. Number 2, it can stuck in the trachea. Number 3, it can stuck in the bronchi. Now, your next question to me will be, Suman sir, you are telling that your foreign body can be at the level of larynx, foreign body can be at the level of bronchi or trachea. How will I come to know whether it is foreign bodies is larynx or bronchi or trachea? Okay, so now see here, we'll come to the presentation. For this, you need to understand presentation. Okay, so now see here. Now coming to the laryngeal foreign body. Suppose now the foreign body is at the level of larynx. Okay, right. So at the level of larynx, this foreign body is obstructing. So whatever the air will, bilkul no entry of air, right? So all, right, no air coming into the airways. That is below the larynx is your trachea and bronchi and lungs. No air at all, because the larynx pura blocked, right? The larynx is fully blocked, so that air will not enter. Right, now quickly tell me, the laryngeal foreign body, how will a child present to the emergency, right? So I know foreign body aspiration is an emergency, but how will the child will present is, see here, there will be sudden choking, that obstruction, and sudden choking plus or minus aphonia. The child cannot speak, right? So there will be choking and unable to speak. The child is unable to speak. Then think of foreign body which is at the level of larynx. Okay, laryngeal foreign body, right? Aphonia is unable to speak, is called as aphonia. Clear? And now coming to the bronchi. So now suppose I'll come to the trachea later. Now see about the bronchi. So now suppose I told you already, the right bronchus is just the continuation of the trachea, and whereas the left bronchus will be present at an angle, right? So this is so whatever the foreign body which is entering the trachea will now directly come into the left bronchus, right bronchus, right? So tomorrow's examiner, if they are asking you whether it is right bronchus or left bronchus obstruct foreign body which is more common, it is right bronchus. foreign body which is more common. Why? It depends, it is related to anatomy. That anatomy I told you just now, right? Okay, so now coming to the tracheal. Okay, so now how will they present? Now before going to the tracheal, I'll tell you how will the bronchial foreign body, how are they going to present? Quickly tell me how the bronchial foreign body is going to present. Yes? Laryngeal foreign body, how are they going to present? Choking and aphonia. But how will the bronchial airway obstruction will present to you? Now the foreign body, the peanut is in the bronchi, right bronchi. Anything which is obstructing the airways, what it is going to cause? When I place my stethoscope on the child chest, immediately I will be listening to whistling sounds, because something which is narrowing the airways will cause whistling sounds. Wheezing, right? I am going to see wheezing, and along with that there will be sudden onset of cough. There will be sudden cough plus breathlessness. Very important. So again I am telling you, how will the bronchial obstruction cases present to you? Bronchial foreign body, sudden cough. There is, all of a sudden there will be the cough will get started. Along with that the child cannot able to breathe. So that is breathlessness. Okay, so this is how the bronchial foreign body is going to present to emergency. Now coming to the tracheal foreign body, how will they present? Okay, so now I discussed the foreign body at the level of larynx and at the level of bronchi. The whatever is present in between is the trachea, right? The windpipe, the trachea. Now so and so peanut is present in the trachea. You know that the trachea, there is free air moving inside the trachea. So now what happens? This foreign body also will freely move up and down. It is going to dance inside the trachea, within the trachea, up and down like this. Okay, within the trachea. Now that dancing of this foreign body inside the trachea will create a sound which I can hear that. So that is called as auditory slap. So that is called as auditory slap. Clear? And when you take your fingers and palpate the trachea, you can also feel the foreign body which is dancing inside the trachea. So that is called as palpatory third. Palpatory third, very important. So these are the two important things that I will think immediately of tracheal airways, foreign body, right? So tracheal foreign body, no need to break your head. Let me tell you, this won't be asked in your exam, but as a teacher I want to teach you, okay? But this will not be asked in your exams, which is very rarely asked in the exams. The one they are commonly asking is laryngeal foreign body and the bronchial foreign body. Clear? Right. Clear about how the laryngeal foreign body is going to present, and clear about how the children with bronchial foreign body is going to present. Okay, if you are not clear, I am going to take you the case scenario based questions. Let me discuss so that you will get a clarity right now. So here is a case scenario waiting in front of you all. Suppose now you are sitting in norcet exam 9.0 and this is the case you got in your exam. Now let me see who is going to give me the right answer. A child presented to emergency with sudden onset of cough. Okay, the child presented to the emergency with sudden onset of cough, number 1. Number 2 is wheezing. Number 3 is diminished air entry into the lungs on auscultation. So, a child presented to the emergency with sudden onset of cough, wheezing and diminished airway entry into the lungs. Right, what could be this case? So, how many members of you noticed this? What I have noticed here. So, they have asked you, number 1 is sudden onset of cough, number 2 is wheezing, number 3 is diminished airway entry into the lungs. So there is 3 symptoms which they are trying to explain you. So that is triad symptoms. Whenever in tomorrow's norcet exam, if you see this triad of symptoms that anybody is asking you, close your eyes and say them that Suman sir directly told us to answer it as, okay, bronchial airway foreign bodies, bronchial foreign body aspiration. Okay, so tell them that Suman sir clearly said us that this is a bronchial foreign body. Clear? Okay, so now how are you going to manage this case? Now there is a peanut sitting in the right bronchus. How I will remove it? So I cannot put my hand and remove it. So instead I can send a scopy and I can remove it. What is that scopy? Bronchoscopy. Okay, so right. Can you see this image here? So so and so the ENT surgeon or whatever it may be, the pulmonologist or whomever it may be, is trying to send a bronchoscope and he's going to try to remove that foreign body, right? So always remember, foreign body aspiration is an emergency. Clear? Okay, it's an emergency, right? Okay, now quickly tell me the management. Quickly tell me the management. What are you going to do? I told you just now he's going to remove. What is that? Bronchoscopy. What type of bronchoscopy is this? This is rigid bronchoscopy. This is rigid bronchoscopy. And now you are going to ask me, Suman sir, what is rigid bronchoscopy? Okay, right. Let me tell you, there are two different types of bronchoscopies, right? So there are two different type of bronchoscopy, right? Number one you have is rigid bronchoscopy, as I told you. The other one which we have is, the other type of bronchoscopy which we have is flexible bronchoscopy. Clear? Rigid bronchoscopy and flexible bronchoscopy. Rigid bronchoscopy, now you are going to ask me, Suman sir, why are these two types of bronchoscopy, for what they are useful? Okay, now listen to this. Rigid bronchoscopy, it is more therapeutic. Okay, it is more of therapeutic for the treatment purpose. But flexible bronchoscopy, it is too flexible. The bronchoscopy is too flexible, right? The bronchoscopy here, it is too rigid. Can you see it is made up of metal and it is too rigid, right? So the flexible bronchoscopy is more of diagnostic purposes. Suppose, right, it is more of diagnostic purposes. Clear? Okay, right. Now let me show you what is this procedure which the pulmonologist is doing here. Can you see here? Right, so this is the one which is entire, this one is your rigid bronchoscope. Clear? This is your rigid bronchoscope, and can you see there are three ports? Please see this bronchoscope, the rigid bronchoscope. It has three important parts. Number one is this one, number two is this one, number three is this one, right? 1, 2, 3. So what for three ports inside a rigid bronchoscope is my next question for you, right? Number one, the first one, right, which I have highlighted here. So can you see they have connected it to an oxygen source, right? Those also we can connect this for the anesthesia gases also, the first port. Okay, so that port is for gases, okay, oxygen or anesthesia delivery. Clear? During the bronchoscopy. So second one, the second port is the eyepiece. So where I am going to insert the eyepiece and I am going to operate it. So that is what, this is the second one. The third one is the suction port. Okay, so the secretions whatever I am getting in between the procedure, I will suction it out. So that is suction port. Okay, so these are the three important ports in a rigid bronchoscope that you need to know for your exam. Clear? Okay. So again I am telling you, what do we do here is rigid bronchoscopy, right? It is rigid bronchoscopy. Why rigid bronchoscopy, my dears? I told you rigid bronchoscopy is more of therapeutic, flexible is more of diagnostic purpose, right? Why therapeutic? Why rigid bronchoscopy? Because it has an extra port for ventilation. I can also ventilate the patient. I told you, right, there is a gases port, right? That is especially seen in case of rigid bronchoscopes. Okay, so there will be a port for ventilation. Clear? Right. Okay, dear. So now there is one more case scenario which is waiting in front of you. Now you are going to tell me this. I am not going to teach you this. Okay, so now you should tell me, because I already discussed beautifully. I have discussed this. What is this? Yes, by this time everyone would have got this. Yes, a person can now, don't tell me the answer. Okay, always the thumb rule: read the question twice and only then answer, even if you know that. Okay, right. A person while eating something suddenly gets choking and aphonia. Very, very important. There is a child who is eating and suddenly developed choking and unable to speak. Right, choking and unable to speak. What did I teach you? I taught you this in case of laryngeal foreign air, foreign body. Right, so the answer for this is laryngeal foreign body. Laryngeal foreign body, very, very important. And now always note this, my dear students. Please note this point which I'm going to tell you now. Okay, let me ask you one question. Now quickly tell me, so there are two patients in front of me. One patient is with laryngeal foreign body and the other one is with the bronchial foreign body. Okay, so here I am not worried about tracheal foreign body. Why? Because tracheal foreign body is very rarely asked in your exam. So I don't want to go into that and break your head. I want now listen to the question which I am asking. So now there is one student in front of, there is two cases in front of me. One case is with laryngeal airway obstruction and the other one is bronchial airway obstruction. Now tell me quickly, which one is more serious? Which one is more serious? Yes, can you tell me which one is more serious? Whether it is laryngeal foreign bodies that is more complicated or bronchial which is more complicated. Okay, so let me tell you, the laryngeal foreign body is more dangerous. Why? Because here what I told you, there is a foreign body sitting inside the larynx and it is blocking the airway where pura air is not entering at all into the both the lungs. But whereas in bronchial obstruction, I told you right bronchus is the one which is more commonly affected. So the at least left bronchus is getting ventilated and left side of the lung is getting ventilation. But whereas in laryngeal foreign body, no air at all in both of the lungs. Okay, so that is what laryngeal foreign body is more dangerous. Okay, right. So let me write it down. The higher the foreign body, more severe the condition. Higher the foreign body in the airways, more severe the obstruction. More severe the obstruction. Very, very important. So now quickly tell me, how are you going to manage a laryngeal foreign body? Yes, immediately you're going to start with a maneuver. What is this? This is called as Heimlich maneuver. Heimlich maneuver. Right. So what is this? This is a case of Heimlich maneuver. How are you going to do this? I told you this. Don't expect me to detail this. I told you this beautifully. What is this? Whatever it is done here in case of pediatrics. But let me quickly revise this. Okay. So Heimlich maneuver, you're going to give epigastric pressure over the epigastric region. Okay. Epigastric region. Can you see in this image the patient, right? The person is giving pressure over the epigastric region. And tell me, how are you going to give the pressure? In what method you are going to give? That they are going to ask you. Definitely you will get a question on this. Okay, it is backwards plus upwards. Can you see this? Or arrow mark should come into your mind tomorrow in norcet exam. So the pressure will be backwards plus upwards. Okay, first you will backwards and upwards, backwards and upwards, backwards and upwards. Okay, right. So that is how you are going to give the pressure in Heimlich maneuver, right? Okay. So this is suppose now the child is infant. I cannot give this to the Heimlich maneuver. Instead, I can do is, what did I teach you in pediatrics? I can give a back blows, right? Prone, keep the patient baby in prone and give back blows and again anterior chest thrust, right? So that is what? Back blows and chest thrusts I'm going to give here in case of infants. So this is how I'm going to manage a case of laryngeal foreign body, right? So now I know you people are still in a confusion. Now all the confusions will get cleared. Look at this slide. Okay, suppose if any child comes to you with choking and aphonia, so what you will think immediately? Choking and aphonia. What did I teach you? Laryngeal foreign body, right? So this is laryngeal foreign body, right? Now suppose there is an auditory slap which you are hearing. So what is that? Auditory slap and palpatory third. But what is that? Tracheal foreign body, right? So suppose triad symptoms. I told you, right? Sudden onset of cough, wheezing, and decreased air entry. What is that? This is a case of bronchial foreign body. Very important. So now let us quickly see a few congenital diseases of the larynx. Okay, right. Now let us quickly see the congenital diseases of larynx. Now you people are going to tell me this.